Drugs acting on digestive system review questions.
These drugs are administered to improve the appetite and digestion of food. A. Stomachics. B. Emetics. C. Sialagogues. D. Cholagogues. The answer is sialagogues. Sialagogues are drugs which increases the volume and fluidity of saliva and help improve appetite and digestion of food. These stomachics increase gastrointestinal tract motility through cholinergic muscarinic action. A. Histaminergic. B. Antimuscarinic drugs. C. Antispasmodics. D. Cholinergic agonists. The answer is cholinergic agonists. Cholinergic agonists act to increase gastrointestinal tract motility through cholinergic muscarinic action. Which is not an antiemetics? A. Acepromazine. B. Diltiazem. C. Metoclopramide. D. Isopropamide. The answer is diltiazem. Acepromazine, metoclopramide, and isopropamide are antiemetic drugs. Meanwhile, diltiazem is used as antihypertensive and antiarrhythmic drug. The following drugs are appetizers except A. Prednisone. B. Misoprostol. C. Cyproheptadine. D. Stanozolol. The answer is misoprostol. Misoprostol is an anti-ulcer drugs. These are cholinergic sialagogues except A. Atropine. B. Arecoline. C. Physostigmine. D. Neostigmine. The answer is atropine. Atropine is a drug used as anti-sialagogues. This emetic drug is used to stimulate the medullary emetic center through CTZ. A. Atropine. B. Arecoline. C. Xylazine. D. Dopamine. The answer is xylazine. Xylazine is an example of central emetic drug. These drugs are administered to prevent formation of gases and are used in cases of flatulence. A. Emetics. B. Carminatives. C. Sialagogues. D. Anorexigenics. The answer is carminatives. Carminatives are drugs administered to patients having flatulence. These are drugs that prevents formation of gases and help in their expulsion from GIT. These drugs are administered to relieve constipation and promote elimination of ingested toxicants from the GIT. A. Antidiarrheals. B. Cholagogues. C. Emetics. D. Purgatives. The answer is purgatives. Purgatives are drugs which promotes defecation to relieve constipation and promote elimination of ingested toxicants from the GIT. These drugs promote appetite to overcome anorexia in animals. A. Antacids. B. Anorexigenics. C. Appetizers. D. Antiemetics. The answer is appetizers. Appetizers are used in anorexic patients to promote appetite. The following are antacids except A. Misoprostol. B. Metoclopramide. C. Ranitidine. D. Sucralfate. The answer is metoclopramide. Metoclopramide is an antiemetic and a prokinetic drug. The following are true for anorexigenics except A. These drugs reduce appetite by inhibiting the medullary satiety center. B. These drugs exert anorectic effect, especially to those patients with obesity. C. Anorexigenics act as centrally acting sympathomitics. D. Anorexigenics acts by facilitating central 5-hours T action. The answer is letter A. Anorexigenics are drugs which reduce appetite by inhibiting the hypothalamic satiety center. The following drugs are used as antacids except A. Magnesium oxide. B. Sodium bicarbonate. C. Calcium carbonate. D. All of these. The answer is D. All of these. The drugs mentioned are examples of antacids. This drug prevents gastric acid secretion by inhibiting histamine-induced activation of adenyl cyclase. A. Sucralfate. B. Cimetidine. C. Misoprostol. D. Omeprazole. The answer is misoprostol. Misoprostol prevents gastric acid secretion by inhibiting histamine-induced activation of adenyl cyclase. These drugs are administered to control excess fermentation and production of gas in GIT. A. Carminatives. B. Purgatives. C. Laxatives. D. Antizymotics. The answer is antizymotics. Antizymotics are agents used to arrest or control excess intestinal fermentation and production of gas in the GIT. The following drugs are used as sialagogues except A. Misoprostol. B. Arecoline. C. Nux vomica. D. Quassia. The answer is misoprostol. Arecoline, Nux vomica, and Quassia are sialagogues. Meanwhile, misoprostol is a drug used as antacids. These drugs are given to patients in order to help in removing ingested poison. A. Emetics. B. Purgatives. C. Antiemetics. D. Laxatives. The answer is emetics. Emetics are drugs which cause vomiting in animals to help in removal of ingested poisons. These are administered to increase functional activity of stomach by increasing gastric motility. A. Emetics. B. Stomachics. C. Purgatives. D. Cholagogues. The answer is stomachics. Stomachics are drugs which increase functional activity of stomach by increasing gastric motility and secretion. This emetic is a central alpha-2 adrenoceptor agonist which causes sedation and hypotension. A. Apomorphine. B. Atropine. C. Xylazine. D. Promethazine. The answer is xylazine, where it is a central alpha-2 adrenoceptor agonist causing sedation and hypotension. This drug is classified as antiemetic and prokinetics. A. Misoprostol. B. Diphenhydramine. C. Domperidone. D. Metoclopramide. Answer is letter D. Metoclopramide. The following drugs are classified as carminatives except A. Camphor. B. Ether. C. Gentian. D. Chloroform. Answer is gentian. Camphor, ether, and chloroform are classified as carminatives. Meanwhile, gentian is an example of sialagogues and stomachics. This stomachic is used to detect achlorhydria or hypochlorhydria. A. Dopamine. B. Gentian. C. Atropine. D. Betazole. The answer is betazole. Betazole is a stomachic that detects hypochlorhydria and achlorhydria. These agents are used as pre-anesthetics to reduce salivary and bronchial secretions. A. Sialagogues. B. Anti-sialagogues. C. Emetics. D. Antiemetics. Anti-sialagogues decreases formation and fluidity of saliva and causes dryness of mouth, hence, used as pre-anesthetics. The pharmacological action of this sialagogues is to stimulate the salivary glands. A. Reflex sialagogues. B. Cholinergic sialagogues. C. Direct sialagogues. D. None of these. The answer is direct sialagogues. The following are contraindications of emetics except A. Ingestion of corrosive poisons. B. CNS stimulant toxicity. C. Opium poisoning. D. None of these. All of the statements mentioned are contraindications of emetics. The following are non-systemic antacids except A. Magnesium oxide. B. Magnesium carbonate. C. Sodium bicarbonate. D. Calcium carbonate. Sodium bicarbonate is classified as systemic antacids. These drugs stimulate the contractions of gallbladder and increase bile flow into duodenum by relaxing the sphincter chole. A. Cholagogues. B. Intestinal astringents. C. Sialagogues. D. Cholerytics. Cholagogues is the answer. The following statements are the mode of action of anti-ulcer drugs, except A. Dopamine antagonists. B. Antacids. C. Histamine antagonism. D. Cytoprotective effect on gastric mucosa. The answer is dopamine. Antacids, histamine antagonism and cytoprotective effect on gastric mucosa are the mode of action of anti-ulcer drugs. Meanwhile, dopamine antagonists is the mode of action of Prokinetics. This antidiarrheal is used as GI mucosal protectant or adsorbent except A. Bismuth subsalicylate, B. Aminopentamide, C. Isopropamide, D. Diphenoxylate. Answer is bismuth subsalicylate. The use of purgatives is or are contraindicated in A. Advanced pregnancy, B. Lactating animals nursing an offspring, C. Both A and B, D. None of these. Answer is letter C. Purgatives are contraindicated in advanced pregnancy to avoid incidents of abortion and lactating animals nursing an offspring because it may cause purgation in the young one. These drugs are used to increase formation of bile in hepatocytes. A. Cholagogues, B. Intestinal astringents, C. Sialagogues, D. Cholerytics. Answer is D. Cholerytics are drugs used to increase formation of bile in hepatocytes. These drugs are used as appetizers due to euphoria. However, prolonged usage causes catabolic effect. A. Anabolic steroids, B. Glucocorticoids, C. Benzodiazepines, D. 5-hours T antagonists. Answer is B. Glucocorticoids is an appetizer due to euphoria, but prolonged use may cause catabolic effect or promotion of gluconeogenesis through breakdown of muscle protein. Which of the following drugs are classified as anorexigenics? A. Misoprostol, B. Amphetamine, C. Stanozolol, D. None of these. Answer is B. Amphetamine is an example of anorexigenics which is classified under centrally acting sympathometics. The following anti-ulcer drugs are histamine antagonism except A. Cetirizine, B. Cimetidine, C. Ranitidine, D. Famotidine. The answer is letter A. Cimetidine, ranitidine and famotidine are anti-ulcer drugs classified as histamine antagonism. These purgatives are not absorbed in the GIT, causing distension of intestines, which reflexly stimulates peristaltic activity. A. Bulk-forming purgatives, B. Osmotic purgatives, C. Saline purgatives, D. Neuromuscular purgatives. Answer is letter A. Bulk-forming purgatives are not absorbed in the GIT, imbibe water, and swell, increasing in mass, causing distension of intestines, which reflexly stimulates peristaltic activity. These drugs promote downward movement of ingesta through GIT by inducing coordinated GI motility. A. Cholerytics, B. Antiemetics, C. Antacids, D. Prokinetics. Answer is letter D. Prokinetics are given to patients with gastric stasis, reflux esophagitis, and gastritis, which promote downward movement of ingesta through the GIT by inducing coordinated GI motility. This anti-ulcer drug is contraindicated in pregnant bitches. A. Famotidine, B. Misoprostol, C. Lansoprazole, D. Sucralfate. Answer is misoprostol. It is contraindicated in pregnant bitches because it causes abortion. The following are clinical uses of Prokinetics except A. Gastric stasis, B. Gastritis, C. Reflux esophagitis, D. Enteritis. Answer is enteritis. The clinical uses of Prokinetics are gastric stasis, reflux esophagitis, and gastritis. Enteritis is treated with intestinal astringents. The following are osmotic purgatives except A. Magnesium oxide, B. Sodium sulfate, C. Anthraquinone, D. Magnesium sulfate. Answer is letter C. Anthraquinone is an irritant purgatives. This appetizers inhibit satiety center by GABA antagonism. A. Glucocorticoids, B. 5-hours T antagonists, C. Anabolic steroids, D. Benzodiazepines. Answer is letter D. Benzodiazepines inhibit satiety center by GABA antagonism. The following drugs are cholerytics except A. Clanabutine, B. Potassium glycolate, C. Bismuth subsalicylate, D. Sodium dihydrocholate. Answer is letter C. Bismuth subsalicylate is used as antidiarrheal. These agents help in prevention of absorption of toxicants by adsorbing the toxicants and reducing intestinal secretions. A. Intestinal astringents. B. Intestinal adsorbents. C. Antidiarrheal. D. Cholerytics. Answer is B. Intestinal adsorbents are agents which help in prevention of toxicants by adsorbing the toxicants and reducing intestinal secretion. The following drugs are classified as neuromuscular purgatives except A. Arecoline. B. Physostigmine. C. Carbachol. D. None of these. The answer is letter D. Arecoline, carbachol, and physostigmine are classified as neuromuscular purgatives. These purgatives are not used clinically. Adrastic purgatives. B. Saline purgatives. C. Bulk-forming purgatives. D. Emollient purgatives. The answer is letter A. Unlike the other classification of purgatives, drastic purgatives are not used clinically. This Prokinetics is chemically related to metoclopramide but does not possess antidopaminergic activity. A. Misoprostol. B. Cisapride. C. Sucralfate. D. Neostigmine. Answer is letter B. Cisapride is chemically related to metoclopramide but does not possess antidopaminergic activity. Which drug does not belong to the group? A. Esomeprazole. B. Lansoprazole. C. Methimazole. D. Omeprazole. The answer is letter C. Methimazole is used to treat hyperthyroidism. Which of the following drugs causes emesis? A. Apomorphine. B. Xylazine. C. Both A and B. D. None of these. The answer is letter C. Apomorphine and xylazine are both emetic drugs. The following statements about antacids are true except A. These are used to treat gastric acidity in monogastric animals. B. These are absorbed and act by converting the gastric acid to neutral salt and water. C. These promote local production of prostaglandin. D. These are used in treating ruminal lactic acidosis in ruminants. The answer is letter B. Antacids are not absorbed and act by converting the gastric acid to neutral salt and water. This drug is recommended for use in paralytic ileus in large animals. A. Misoprostol. B. Cisapride. C. Sucralfate. D. Neostigmine. The answer is letter D. Neostigmine is a prokinetic which is recommended for use in paralytic ileus in large animals. These soften the hard fecal masses, facilitating easy propulsion in the intestines. A. Purgatives. B. Laxatives. C. Fecal softeners. D. Antidiarrheals. The answer is letter C. Fecal softeners soften the hard fecal masses, facilitating easy propulsion in the intestine. Delasterone, meclizine, and isopropamide are blank. A. Antiemetics. B. Cholagogues. C. Emetics. D. Purgatives. The answer is antiemetics. Delasterone, meclizine, and isopropamide are drugs classified as antiemetics.